All right, friends, welcome back. We are here at the Pro Aging Podcast, Season 3, Episode 3. And today, we are talking about one of my favorite subjects, the body. And I have a world-renowned leading expert in body sculpting here. We're going to have a lot to talk about it because we have a lot of things in common, but we also differ in our expertise. And we have Dr. Ryan Neinstein, who of course is the founder and head of Neinstein Plastic Surgery. Now, the best aspect of his resume is that he's Canadian, okay? We love Canadians here at 𝐕👑 𝐄𝑟. They're skilled, they're great physicians, they're just great people. But he has a whole list of accolades really in the publication, lecturing, and really honing the advancements of body sculpting, which we know we all need here. So we're gonna talk about how we overlap, how we complement each other, and he's really going to give us a perspective on his area of expertise, which is not only liposuction, but of mommy makeovers. So thank you for coming, Ryan. Really appreciate you having here. We've been working together for a few years now, and I think one of the greatest things that I've seen you do in your career is make body sculpting cool again. This is something I've struggled with for 25 years. And where I think we could both agree in the field of plastic surgery, your own field, face was always the cool thing to do for many years. How did you come across, having this drive in the field as a body expert? Where did it all start? Give me a little background.
Oh, well, first of all, thank you so much for having me. This has been something I've been looking forward to for a long time.
Cool.
But my journey begins, in Canada. I grew up always interested in science, was big into sports, and medicine just seemed like the perfect combination where you can be, the intensity of athletics and they have the, the scientific knowledge there. And then it quickly led me into surgery. That just felt, I liked the immediacy of the results. Yeah. I liked seeing a problem, fixing it with my hands, and moving on to the next thing. And then in plastic surgery, to me, body contouring was something that no one was really specializing in. It was something that was done.
Yeah.
But like you said, it was complementary to the rest of the practice.
Yeah.
And I decided that I just liked the story that body contouring told.
Yeah.
I like when moms come to me and tell me that I only wear, hoodies and sweats after all my kids, even though I work out every day of the week. 6 months later, they're wearing a form-fitted dress and back in a bikini. That's something that's monumental in terms of the change in their life.
Yeah.
And that provides me a lot of, happiness to be able to give to them.
Yeah.
And that story of those significant changes from one decision, even though it's a big operation, drove me to focus. And I think the world, we're all looking for more mastery and hyper-specialization now.
Funny what you said to me, how it used to be considered an add-on. I found that with liposuction. I used to come across so many patients 20 years ago, and it was like something that they did in addition to their nose or in addition to their breasts. They weren't really looking at it as a sole area of expertise or to do it alone. It was always like an add-on. And I think that's one of the things you've really done is made people think that their body deserves that level of expertise and focus. Now, we know a lot of the type of procedures you do are quite complicated, right? You're dealing with muscle, you're dealing with fat, you're dealing with skin, and you're now, and we'll talk about this later, dealing with a lot of circumferential stuff. It is a big procedure and it takes a lot of coordinated care. In some ways, often more than even a facelift. How do you really prepare people for this journey?
So this is something we've been working on, over the last decade in my practice. Is really building, surgery does not finish when you leave the operating room. It's almost like you just begun. Yeah. The easiest part of these body transformations is the operation itself.
Yeah.
By focusing, we've really been able in our practice to be able to put the pre-surgical era together. And that right now has a lot to do with nutritional counseling, preoperative medical clearance. The surgery itself has really taken a decade to be able to get to a place where in terms of facilities, we always have 2 anesthesiologists, we have 10 nurses. Most offices has, one or 2 nurses walking around. We've handpicked these nurses from the best operating rooms in town. Everyone wants to be there. People always ask, how do you like doing the same procedure every day? I said, it's great. It's like Billy Joel sells out the garden singing Uptown Girl.
Yeah.
He doesn't need any new songs.
Right. But they're all different every time he sings it.
Correct.
A
Exactly.
lot of
Just
variation.
like every operation is different. And then the real evolution, which I thought has really brought our practice international, was the evolution of the aftercare. And now patients, with the biggest anxiety being recovery, the fear and stress of recovery from a big operation.
Yeah.
Now our packages, are full service, meaning you fly into New York or you walk over from, if you live on the Upper East Side, and you recover usually at the Plaza or one of our other partner hotels. Okay. And we have 24/7 nursing care. And that nursing care is not just a nurse sitting there babysitting you. That's active management, not just checking your vitals, making sure your blood pressure and heart rate are okay. They are monitoring all the breast, the abdomen, the fluid management from the liposuction, the drains. We're now using incision management systems, adding, all new types of technology.
Yep.
The medications itself is, a complex quagmire grid in order to minimize the narcotic use. Getting patients in and out of bed requires a ton of, certain supplies. We don't ask our patients to go around CVS with a laundry list picking stuff off the shelves. We provide everything from the medications to the supplies to the nutrition. This is too important.
Coordinated care.
Yeah.
And there are too many things that could happen, right?
Yeah, I don't trust anyone to do it. If giving someone an instruction manual to a plane and saying here, take it.
And I see you do show up and you're visiting the patients yourself and things like that. Again, I think similarly where we came, at least I came from an area of training as a solo practitioner, small boutique type things. You have to really create a coordinated symphony of care.
Correct.
And this is true at any level, I think, of aesthetic medicine. To really provide it, patients really need that type of that care. Now, let's talk a little bit about the types of procedures that are out there. Because as I've mentioned before, I've been doing tumescent liposuction for a few decades. Your area of expertise is usually in a much more, not severe, but you do more complex surgeries.
Correct.
My goal is always patients, small areas, resistant diet exercise. They want a 24-hour recovery. They want to be back at work in 48 hours. And my coordinated care really works on getting them back to there. I think a lot of people are confused the difference between a mommy makeover. You do tumescent liposuction also.
Correct.
Tell me a little bit about how, when you examine a person, what are some of the things determining what they need, like muscle repair or things like that?
So in general, I think of, contouring alone without removing skin or lifting or tucking, whichever way you want to call it, is typically, prepartum and without significant weight loss.
Right.
Basically, if you have good skin integrity and you have stubborn fat areas, that's where liposuction comes in.
Yeah.
Little bit of liposuction, tumescent, local, quick healing, more extensive. We do full bodies. People come from all over the world. That's going to have extensive, you can't have full body liposuction without the same coordinated aftercare as a mommy makeover.
Exactly.
Now, once we move into that postpartum, a lot of women sit in my exam chair and they grab their stomach and they say, just suck out some of this fat. And we explain to them that, they typically have the frame of a twin bed, but the bedding of a king bed.
We can show them on the camera. It's like that when they go like that, right?
Exactly.
You've seen them do that.
And we show them what the muscle separation looks like. And I don't care who you are. If you've had big, kids, multiple big kids, and it's going to separate and it's going to stay separated. And your intestines, your guts are going to lean against your core like a screen door and it's going to bulge out.
Yep.
And you're going to have to hold your breath in to stay tight in a dress, or you're going to have to wear compression underneath everything for the rest of your life.
Yeah.
And, when we do a tummy tuck, which is part of a mommy makeover, we're sculpting, fixing the muscles, and getting rid of skin. But the biggest issue, it's not an issue. It's the education is, nobody wants a tummy tuck. Everyone wants the results of a tummy tuck.
Right,
Everyone likes the idea of a little lipo.
That's right.
And
it doesn't work like that.
I always say, the most dangerous words in plastic surgery is a little lipo.
Yeah.
And we see
it's like being a little pregnant. Right?
Correct. If you're, you've had 4 kids, you're 5'4", 110 pounds, and you're grabbing a bag of loose skin, you're not going to look better with liposuction.
Yeah.
In fact, you're going to look worse.
Yeah.
So that's really where we're at.
And when you have pendulous skin, there are even people who don't have muscle issues, right? If they're just pendulous skin, there's only so much you can do with the technology.
And now we're in a new era where we do just as many tummy tucks on people who've never had children as we do on people with children.
Yeah, wow.
So we just start peeling off things like muscle repair. But what's interesting, we're noticing in the weight loss patients, is the muscles separate probably just from laxity in the fascia. It doesn't really matter if you've lost 100 pounds.
When they have visceral fat that's stretching the skin.
Correct. Yeah. So we're basically doing the same procedures. That is brand new, like in the last year and a half.
Can you do a tummy tuck on people who are still planning on having children?
So
this is a big question everybody has.
So I always tell people, like, if you're going to do this, you should probably wait until you finish your family planning. Now, after doing 5,000, I have a dozen or so people who've, people get pregnant. So
they get pregnant,
you
right?
think your family planning's over, but it happens. And they've all been fine. Some of them need a little tune-up after, but it doesn't cause any problem.
It's not dangerous.
It's not dangerous at all.
Okay, because I think that's a major concern.
You can expand your abdominal wall even with a muscle tightening.
Yeah. Because I do have patients, I've had many patients who are like, listen, I want to do something. Their skin's still elastic. I'll do a little lipo on them. I said, listen, you can go on and have a tummy tuck down the line. They're like, I just want to look good enough for a while in clothing. I know ultimately I want to look better naked, and that's when I'm going to need something like your expertise.
And I think the most important part is a really good conversation with the doctor and the patient. If they are postpartum or have any lax skin and they're only going to have liposuction, they really have to know they're not going to have one of these, ab board, their stomach is not going to be super flat where they're not going to be able to pinch skin. And some people are happy with a little bit of fat reduction, but that conversation has got to be real and like candor, and there's got to be radical candor there, because if people think a little liposuction is just going to, fix their muscles and flatten their tummy, you're going to be in, it's not fair to each party, the doctor and the patient.
And I think all of us liposuction surgeons, especially ones who come from a tumescent, minimally invasive background, in earlier parts of the career, there are some patients they convince you and you do that patient who's a little bit bigger than what it needs.
Correct.
And again, ultimately, the patient is the one that's going to come back a year later, 2 years later. Their weight isn't stable. It wasn't enough. And they should have gone for a bigger procedure in the first place. It's all really always about patient expectations.
Correct.
Right?
Yeah. We always ask patients what they want and then pick the procedure. It's not the other way around. Most patients want to tell you the procedure and then tell you what they want out of it.
That's right.
So I want a little bit of lipo. I don't want any downtime. And I want to be flat as a board.
Right.
Or like, okay, if you want to be flat as a board, let's go backwards.
What are you telling people, one of your standard mommy makeovers? We know there's a spectrum of complicated, but what are you really telling people in terms of downtime? How many days with nurses in a hotel room? How many weeks off of, everyone wants to know about exercise.
Yeah.
Give me a basic for the audience.
How this works is they will speak to a coordinator first, then the nurse, then me at the consult, and then another nurse again before they book, because we're really you got to be ready for this. Yeah. This is not a week before your daughter's wedding.
Yeah.
So we tell people, and I tell them, the first week you're essentially completely useless. Okay. The first 3 or 4 days you cannot get out of bed without help. You can't eat, you can't drink, you can't do anything without 24/7 supervision. Now, the operations we do are more comprehensive than others. I pull the skin tighter, we tighten the muscles more, we do more liposuction at the same time. You can throttle down on these operations, but, people's expectations are high.
Yes,
so we warn them, we're going to do this, I don't want to say
there's one way to do it, that's the right way.
We're going to be more comprehensive. We're going to complete this for you, but the downtime is real. The first week, we need 7 days, 4 days of nursing supervision. By the 4th day, everyone should be able to go to the bathroom, which is the big milestone. Once you, poop, that's okay. Just say it.
You can say that.
Once you go to the bathroom and you can eat and drink and change your garment on your own, you're fine.
Yeah.
At a week, you come into the office. So most people stay in a hotel for 4 days. If they're from out of town, 7 days. At 7 days, we take our incision management system off. This is a vac that goes on the skin, not in the skin, but on. Yeah. Increases blood flow. It's like built-in hyperbaric.
Yeah.
We're pushing things around. Let's get as much blood flow as possible. At a week, the drains come out and the incision management system comes out. Usually, sometimes the drains stay in longer. But the next 3 weeks, so a full month, you're basically we are your whole life. Okay. I tell them we're it. Okay. You're not mother. You can work remotely, but this is a full month commitment.
Yeah.
To change your whole body, it's going to take a full month of downtime.
Yeah. But wow, the results.
It's game changer.
You're changing your life.
Correct. And so we have these real long conversations before someone signs up.
Yeah.
And obviously everyone's a little different. Some people heal faster. Yeah. But for 3 weeks, they're bent over. We pull that skin tight and we teach them how to walk bent over.
Yeah.
They're not hinging at the waist. They're bending in their knees because that skin stretches. And by about a month, you are kind of feeling normal.
Right. And this is why you don't go to someone who
You
is
can't
like
dabble in this.
is like a face surgeon who also does tummy tucks. So it does this, or just does a lot of breasts. It's something you really got to be an expert on here.
Well, the interesting thing, about half of the patients we operate on are revisions, and the revisions are not from what people think like botched. They're just not great results. Yeah. There's nothing wrong with them. Yeah. They're just like not that tight, not really sculpted.
What percentage of revisions?
About half of our cases are revisions. The scar is high, the belly button looks weird, just not enough skin was removed, not enough lipo was done, not enough muscle repair. And usually I'll ask them how long was the downtime. And they'll say it wasn't so bad. And then I say, well, it's usually proportional to what you're getting out of it.
Yeah.
And there's nothing wrong with that. Just people now can see results from everyone. So they say, I just want, if I'm going to go through all this, I already have the scar, I might as well do it again and get it to the extent that they want. I mean, it's people's, my scrub tech, Randall, he's doing this for 40 years. Like the person who wrote the original plastic surgery textbook in the 80s, he was his scrub tech.
Oh, really?
And he has worked with since the 80s, every big body plastic surgeon.
Wow.
He's like, these results are these guys, because most of them are dead now, could not even imagine.
Right.
And he's literally seen 20,000 tummy tucks, the whole evolution.
Wow.
They weren't doing low incisions, so they weren't doing new belly buttons. Yeah. They weren't doing lipo.
Things evolve.
He's like, you show these, and then they also didn't have patients who did Pilates 5 days a week and take care of themselves.
People have less downtime, more demands, higher expectations, more options, which is why we need the specialization.
Yeah.
Let me ask you about something.
Really drill it in. You have to give us a month of your life.
Let me ask you about something I get asked a lot about, that I have my own opinion. I want to hear about yours. And that is ab etching, the gladiator, the false definition. How do you approach that with patients? What do you think about that procedure? I have my own opinion.
So when it comes to liposuction alone, so they're prepartum, meaning they haven't had kids and they have pretty tight skin. It's not really my style. Everyone,
I like that.
every cook has their own, You can't ask someone, an Italian cook to make you sushi.
That's right.
And I like it just like a timeless, elegant look. That's just the way I like to operate.
Yeah.
But we have, our new surgeon, Dr. Pierre, specializes in it.
Really?
Because there is a huge demand. In the right patient, when there's no loose skin, it can look, listen, it can look pretty dramatic.
Yeah. Well, let me tell the audience what ab etching is. Basically when you're enhancing the 6-pack, the 8-pack, the whatever pack it is that you may not have had or you have underneath that skin. Some people are just genetically born with great definition. Some people would reveal it with weight loss, a bunch of different things. But surgically, there's a way to enhance that definition.
There's really creating hills and valleys.
Yeah.
And if it's done skillfully, in the abs, they're going into the chest, they're going into the shoulders, they're going into the arms. And a lot of these patients, if you're chose properly, these are people who are into fitness. The results are
they can be amazing.
They're far beyond what you can do on your own. It's not even just fat reduction.
Right, of course.
But it takes the right person who wants, I don't know what that's going to look like in 40 years.
That's my concern. Yeah. Because I've been doing this 25 years, and I think ab etching has been, big for 10. I started seeing it about 15 years ago, and I see so many people who just looks like they have lumpy coals of fat and scar tissue. Because even if you stay really fit, even if you stay so fit, gravity falls. The skin falls over the scar tissue. What you're doing is you're taking a cannula or a laser or radio frequency device, and you're literally creating this etching out of where the muscles would be. But we age around that. Correct. So I always think, and I've had patients that walk in my door 10 years later, and for other things or whatever, and they start talking about the lipo they had done 10 years ago. So I think it's a controversial topic. Yeah. You and I see, I always think short game, medium game, long game with everything that I do.
The patient demand is there.
I know.
Sophisticated patients, you can tell them, hey, this may look a little funny in 20 years.
Yeah, or really
You know what
funny.
they say? We'll do something else.
That's
why they invented plastic surgery.
That's right. Let's talk a little bit about scars, because this is where you and I started working a lot together. Again, short game, medium game, long game. You guys really do an enormous amount, it appears, with scar management and things like that. No matter how good of a surgeon or a laser surgeon or anything like that, some people just don't heal well.
Correct.
What are you doing surgically and post-surgically to help minimize these things in susceptible people.
Number one, acknowledging that you're going to have scars.
Telling
and making sure people know, like, there's no magic. You're going to have a scar. We can give you a really good scar, but you're going to have a scar. But you are trading the stomach that's sitting at your knees for a flat tummy for a scar.
Yeah.
I'm still at 100%. I think 8,000 tummy tucks. Never seen one person ask to go backwards.
Right.
So, but it's a big leap for people who don't have any scars on their body to get a 60-inch scar.
Yeah.
But that's how dramatic the transformation is, that people, are signing
Are you
up
doing
every day.
anything specific?
So there's some newer techniques. So the first thing we do in the operating room is progressive tension. And let me tell you what that is. So we used to kind of just pull the skin down and then sew it. So the skin would be tight. Now what we do is, as we're pulling it down, we're sewing the skin to the muscle underneath. So each time you put a little stitch in, you're taking a certain amount of tension off. So when you get to the bottom, the skin is just kissing.
Yes.
So that alone has changed the scar, because it's not pulling.
You're spreading out the tension, so it's not all at the incision line. Yeah.
And that technique is not done by everyone, because it adds about 75 minutes in the operating room. Yeah. It's individual sutures, and you got to place it just right, because if you put it too superficial on the flap, you'll get a dimple.
Yeah, I mean, we have to do this with flaps with 𝐒𝐳 surgery and skin cancer surgery too. You have to spread out the tension.
Down.
Yeah.
And then, meticulous closure by the surgeon. We don't have an army of people, as I think people think, like, in their operating. Like, we do the operations ourselves, the surgeons. The sewing, that's like our Zen time. That's like, you get to, like, listen to your music, do your craft. That's a great time.
The hard work is done.
We're using tiny sutures. And then we put the incision management system on. Okay, so now we're at like 3 or 4 things we do. And then we keep you bent over for like 2 weeks. Oh, yeah. Like, we literally do not let you stand up straight.
Yeah.
And people hate us because their back hurts.
That's right.
But if you're bent over, there's no tension. We don't want the skin to be anything but just like sitting and touching. Right. And even then, some people don't heal well. And at about 6 to 8 weeks, our basic thing is the silicone strips. Yeah. But when patients are looking for better scar management, we just refer to the experts.
Yeah. So we usually at 4 to 6 weeks is when we consider people who have a history of scars who know they don't heal well. We just prophylactically V-beam, pico, laser, medlight. You can, in advanced stages, Fraxel, CO2, non-ablative, tattooing. There's so many things. The point of the matter is that you really don't have to be as afraid as people used to about scars, because there are so many things you can do on the part of the surgeon, on a part of the post-op team, and as part of the dermatologic team to really guide you through the way.
And the patients like when we refer them to you.
Yeah, we work together.
Because they want another expert.
Yeah.
They don't believe that I'm a laser expert.
Yeah. Yeah. And I'll tell you, it's been really amazing too, even with things, because we know all surgeries, no matter what we do, can be imperfect with little things, like little looseness around the belly button. Like we've worked together with 𝐿ACOR patients that have worked amazing, the fractional microcoring that removes skin. Because what happens is people just get greedy.
Yeah.
They make such dramatic changes. They have this image of themselves. And sometimes, I wouldn't say some can be difficult in their expectations, but a lot of people just are like, listen, I've come this far. I've spent so much money, so much time. If there's something else I can do to just take it up another 10%, and there are things that we can do for that's amazing.
Doctor, we always say this patient, that patient may have unrealistic expectations. They just don't know what they like. We show on Instagram these monumental changes. They're like, just get rid of this.
And they'll compare to their friends too. It's like every case is completely different.
Correct. And usually when you explain what you can and cannot do, they're okay with it. Yeah. Now, sometimes they're like, well, go figure it out. But that's few and far between.
Yeah.
But the scars, you really have to be committed in the operation to the scar, even though that's the last part of the operation. And you think when you're doing something that affects the whole body and you're, it's life and death situation, but you still have to be, every move you're making is committed to that scar.
Yeah. 2 other controversial things that people always ask about. I'm going to first ask you about the mini tuck, which again, like being a little, people come in, everybody wants a mini. They want a mini facelift. They want a mini tuck. They want micro liposuction. They want everything. I'm assuming your answer is going to be, if you're a candidate for a short scar, we give you a short scar, but I'm here to give you the comprehensive full treatment.
Correct.
So what do you say?
So I tell them 5 years ago, I did a lot of mini tucks. Today I do 0.
Yeah.
And I've learned my lesson. A wise person learns from their mistakes. And it wasn't that I hurt people, but they had such inferior results.
Because you're giving a shorter scar.
we didn't get the skin out.
Yeah.
And we didn't, perform the torso contouring that they came to get. Even if you do a muscle repair, but you leave extra skin, there's like a dysynchrony. There's no harmony to the abdomen, and you can see it from across the room.
Yeah.
And I converted a lot of those minis to fulls.
Yeah.
And now I don't offer a mini tuck. We do offer C-section scar revisions, but I won't do lipo at the same time. I'll stay away from the abdomen. I'll say I'm happy to fix your C-section scar, but if you lipo the abdomen and do your C-section scar, you're going to think it's a mini tuck and you're going to be disillusioned.
No, I do the same way, and I think this is true. It comes from experience and practice. You always want to make patients happy. That's inherent, I believe, in all quality doctors. But you get to a point where you have to think in their best interest, and a lot of times they don't know what they really want. What they want is a great result, but you know better on how to get that result. Yeah. It's true with laser surgery. People come in and be like, "Oh, just get rid of my brown spots." And I'm like, I got to work on your acne scars and the capillaries and the this and that, because if I remove one aspect, it's like cleaning one wall of a room, and you're going to notice everything else even more. And you get to a point where if someone doesn't let you do your job the way you see it, of course we have to explain to them why. But just be like, listen, you have to trust my better judgment. There are a lot of other providers you can go to. I just don't think I can give you the results you're looking for by you directing how I need to do it.
And I find social media is a great way to constantly educate people.
Constantly, that's right.
Patients come into our office and they're like, I know what you're going to say. You're going to say I need a full tuck. You're going to say I need a muscle repair because I look exactly like the 3,000 women you showed over the last 3,000 days. Yeah. And they've like, I've given up. I know that I'm not a mini tuck candidate. I know I'm not a liposuction candidate. And I think that is worth repeating every single day. We kind of tell the same story every day because we want people to know we know what we're doing. It's based on real experience. Right. And we don't want to give any smoke and mirrors to the patients.
Yeah. What about, this is a thing we've shared patients on too, the reverse tuck, the up, which we know is a mixed bag. So this is, what do you call, what's the name of it?
Well, there's like a mini reverse tuck, then there's the full reverse tuck.
Basically, it's when people come and they're pretty tight down there, but they want this lifted up.
What's interesting, I find the best candidate for that is someone who had a mini tuck, because usually the extra loose skin was above.
Yeah.
So now they have a little scar below, and then they get the full scar above.
Yeah.
So, and that chevron incision, you kind of really need to go all the way across. And it's the same incision it actually heals well, but it's the same incision as a liver transplant. So it's a pretty dramatic incision.
It's a big scar. Can you hide it in breast scars?
Yeah. What's interesting is like, it's the same as the breast lift scar. It's the scar that goes across the sternum, right in the midline, that people are worried about. They do heal well. They're few and far between, It's a tough predicament for these people because they're thin and it's really just above there. There's few people that just have laxity above the umbo. But I probably do half a dozen a year.
Yeah.
It's a pretty dramatic procedure. You can pull it up. I mean, I don't want to get too gory, but like you have enough skin to like pull over your head, a lot of people. And you trim that off and it looks incredible.
Oddly, it's so funny because I find the skin tightening procedures we do, because again, we have a lot of these very thin, very fit women, and they just wish, like they look amazing, but they just want that little lift. They don't need or want to go through a bottom tuck. And the non-invasive, whether it's Ellacor, Ultherapy, aggressive microneedling, a combination thereof, I'm surprised that actually I find this area non-invasively responds better than the lower belly. Yeah,
well, that's where the stretching from pregnancy happened. The lower abdomen's going to have less collagen left over, less elastin.
And I do find for those patients, and I'm nothing specific about your patients, but I see a lot of people for other things they've had tummy tucks from wherever around the world. That's still that last area, that barrier above the belly button. And that's where the complementary care of the non-invasive, because that icing on the cake type of thing.
And the patients like non-invasive. Yeah. And the providers, like, we don't do any of that. But that's because we don't know how to do it.
Yeah. And again, this is very commonly how I work with the facial plastic surgeons. You tell people think they're going to be, I'm going to go for a facelift, I'm going to get a tummy tuck, I'll never need a procedure again. Patients still need their Botox and perioral filler. They still need their lasers. 5 years after a facelift, they still need some volume restoration in a preauricular in front of the ear. And all the body patients that have tummy tucks, I'm still doing cellulite treatments. I'm still getting rid of sun damage. I'm still toning up the skin. We're on this journey for life of trying to look and feel good, right?
Yeah. I mean, and it never ends. And as soon as you do something dramatic, you just want to keep going.
Yeah. Let's finally talk about the Ozempic area, right? Ozempic face, Ozempic body, all these things, both of us, we're seeing a lot of the positive repercussions and negative repercussions of the new, advocation of getting down to ideal body weight. And you're doing a lot more circumferential work now. Tell me about that.
Well, I think the GLP-1s has changed society, in America and globally for sure.
Yeah.
This is a game changer. For good or for bad, we don't know yet, but we do know that there is an unprecedented amount of quick weight loss.
Yeah.
And when people lose weight, they have loose skin all over their body, and they hate it because it's a stigma. It reminds them of their previous
and the older you are,
self.
the more it
Correct.
is. It's different when you lose weight at 25, 30, right?
So we're seeing two groups. We're seeing a lot of moms who are trying to, accelerate their postpartum weight loss. So they're doing, they used to get down from say 160 to 130 for their tummy tuck. Now they're getting 160 to like 110.
Oh.
So the traditional tummy tuck is now circumferential for a lot of people because the laxity, it's the same as anything else. Like the regular tummy tuck is almost like the mini tummy tuck if you're on GLP-1.
Yeah.
You're going to be left incredibly disappointed.
When they mean circumferential, he's making incision all the way around.
We take it all the way
Not
around.
just from hip to
Because
hip.
you're just as loose when you have that much weight loss on the sides and in the back. And I see a lot of revisions where they have a nice abdomen and then they just come in and they're grabbing everywhere else. And all we do is keep it going all the way around.
Yeah.
And our techniques for these they're brand new. They're completely
Yeah.
evolved. The way we recover them is completely evolved.
Yeah. And there are issues with them staying on the medicine, right? Anesthesia issues.
Yeah, we stop 3 weeks before because you can, if the stomach is not emptying, that stuff can go into your lungs during surgery.
Yeah.
That's no bueno.
When do you restart them?
So it's controversial. Some say after the first bowel movement. We're trying to wait a month. And the reason and the biggest issue, and every plastic surgeon who's dealing with this, and probably every surgical specialty,
Everyone.
the protein depletion is causing an unprecedented amount of complications.
Yeah. Decreased healing. I see the same thing.
Infections
Wound healing.
and wound healing. And when you do big operations, these are not little wounds. These are not put a Band-Aid on. These are, back to the operating room, new scars.
Yeah.
And we are hammering it home to patients. There's a good study that just came out, 75 grams a day. That's 3 scoops of protein 4 weeks before and 4 weeks after surgery. Dramatically, significantly improves wound healing.
Yeah.
Now, the thing that we're noticing, because I'm boots on the ground, seeing these patients every day in the hotel, they have a mental aversion to food.
Oh, yeah. I know.
People pouring out protein drinks in the toilet, they know they're not going to heal it, and they won't take it.
Yeah, it's unbelievable.
It's a mindset. Someone who was big and is now small.
Yeah. Well, it's also
Food
the drug.
is an enemy.
It's also the drug because the drug is being researched now for addiction.
Yeah.
Because it gives an aversion, almost as if food is like a drug.
Yeah.
Sugar, alcohol, cigarettes, things of that nature. I do believe on a dermatologic level, these GLP-1 agonists also have a immunomodulatory capability. The protein deficit affects his wound healing. That being said, I've had some patients.
Infections.
Yeah. But in the longer term of healing, where people are healed, wounds have healed, but there are a lot of people that carry months later significant swelling, bloating, retention of water. The GLP-1 agonists I find are beneficial because what do? They immediately relieve you of
everything.
It's almost like going on a keto diet.
Interesting.
People who go on that. So I think the longer stage of healing, it almost has a positive immunomodulatory. And think of it. What do you tell people who have chronic immune sensitivity? Stop dairy, stop sugar. What do the GLP-1 agonists do? They totally affect your sugar metabolism in a positive way, which is why people are having less diabetes, less heart disease, less sake. I believe there's some more long-term immunomodulatory things we don't even know yet. So
yeah,
we'll
those
see
drugs
about
are here
that.
to stay, and the newer drugs coming out are even more potent in terms of how fast they can reduce the body mass.
Yeah, and
body
they may
weight.
be pill form, which it gives it to a whole new group of people.
And I see the compounded stuff advertised online. Big companies are coming out. This isn't like just a random pharmacy, in Jersey. We're talking like Hims, billion-dollar companies coming out with their own version at like very affordable rates. Well, meaning it's going to be ubiquitous.
In the United States, I don't know what it's like in Canada, but what is it? 2/3 of the American population, over 200 million people, are overweight. 1/3 over 125 million people are clinically obese.
Yeah.
Okay. And now we only have about like, I don't know, is it 5 or 10 million people of that 125 that are taking GLP-1 agonists? You think this is going to be a money boon?
Yeah. And I also think all those people, I think, and I don't know this for sure, but people want to lose the weight. It's just really difficult.
It's not just about looking good. It's really about feeling good and about creating some.
I can't imagine that many people, if you said, would you rather be, this obese or much thinner? Just saying like, oh, I feel better when I'm, incredibly obese. So that's why there's no barrier. The only barrier to entry now is like financial. Once that gets stripped
and getting
away,
over the shot.
Yeah.
Type of thing.
Well, once all that gets stripped away, I don't see any limitations on people on it. And I also don't see any limitation on people being on it for time, because if you stop it, obviously some people can manage to change their lifestyle, but most people,
it comes back with a vengeance.
Yeah.
The real question is, we're going to be the long-term issues, carcinogenic or other types of things. We could all agree that for people that are truly obese, regardless of the risks, they're going to live longer by not having obesity. Man, one of my, we know several people in our lives that really have just changed their lives for the better, gotten rid of their blood pressure, their diabetes, all these things. So that being said, you and I, and all of us in medicine who live in a very highly specialized field, we love this stuff. So we're always trying to drive innovation, drive techniques, teach and learn as we go along the way. What does Dr. Neinstein think the evolution will be over the next 20 years? How do you want to drive it? I mean, you're learning new techniques in the Ozempic generation. Are there certain things that you see that you want to?
Just on an overall basis, I want to be more involved in moving medicine from a transactional process to a relationship-based process. I think that's when you can make a more meaningful impact.
It used to be like that, and then it became transactional.
And then we all hated it. And I think medicine is an amazing, it doesn't matter what field you're in, it is still an amazing career choice. And I think as we all move, I'm trying to personally move my practice and the surgeons in my practice and the nurses in my practice to really establishing relationships where we become part of our patient's life and not just, in and out.
Yeah, that's right. I could not agree anymore. We do the same thing here, and I think that's why you, me, and a small handful of other surgeons that we're all close with really see eye to eye. And I think patients really do appreciate that. And I think it's an excellent example to set. And I think you're an example to other surgeons and to patients. And it's a pleasure to work with you.
It's a pleasure to work with you too.
So happy to have you here.
You can follow me at Dr. Neinstein on Instagram, NeinsteinPlasticSurgery.com. And we have 2 offices uptown now, one above Bergdorf's and the other on Park Avenue, just opened last week.
All right, gang. You heard it here. Body Sculpting, Season 3, Episode 3. Wherever you may be, you are here with us. And I'll see you soon. Good to see you.